I've got a particular interest in diabetes in the use of technology to support people with diabetes, so using things like insulin pumps and continuous glucose monitoring, which we've pioneered some of those developments in Harrogate. And then my endocrinology work, we look after people with thyroid disorders, with things like polycystic ovary syndrome, which is quite a common problem affecting women, and then I have a particular interest in osteoporosis, so helped set up our osteoporosis service here in Harrogate with bone density scanning, and gender endocrinology, so I see people who are transgender and help them in terms of finding the right hormone regimen to help them on their pathway to transition. Really in the north of England, in terms of transgender endocrinology, there is probably nobody else who's regularly looking after transgender people and sorting out their hormone regimens. For things like combination thyroid hormone treatment, there are very few people who routinely offer that as an option for people who are struggling with their thyroid hormone replacement. And seeing the work that we've done that's sort of helped to drive the use of technology nationally, I think has been really, that's been very rewarding. I think actually offering combination thyroid hormone replacement is something that is it's not easily accessed. It can be incredibly effective, and people who've been struggling with their thyroid hormone management for years, you suddenly can transform their lives really, which again I think is very rewarding. And then obviously looking after people, transgender individuals who, that hormone treatment is absolutely critical to them being able to move on with their lives.